What are the main TB risk factors? Tuberculosis, or TB, is a serious infectious disease caused by bacteria that primarily affect the lungs. Understanding the risk factors associated with TB can help in prevention and control. TB risk factors can be divided into two main categories: those that increase exposure to TB bacteria and those that heighten the risk of developing active TB disease after infection. First, let's talk about the risk factors that increase exposure to TB bacteria. Close contact with someone who has active TB, especially if they have it in their lungs or throat, is a significant risk. Being born in or frequently traveling to areas where TB is common, such as parts of Asia, Africa, and Latin America, also raises the risk. Living in crowded places like homeless shelters, correctional facilities, or nursing homes can make it easier for TB to spread. Additionally, certain jobs, especially in healthcare settings where TB patients are treated, can expose workers to the bacteria. Now, let's discuss the factors that increase the likelihood of developing active TB disease after being infected. A weakened immune system is a major factor. Conditions like human immunodeficiency virus, or HIV, significantly increase the risk of latent TB infection progressing to active disease. Other health issues, such as diabetes, viral hepatitis, and certain cancers, can also impair the immune response. Treatments that suppress the immune system, like certain medications for autoimmune diseases or after organ transplants, can further increase this risk. Recent infection with TB bacteria is another important factor. If someone has been infected within the last 2 years, they are at a higher risk of developing active TB. Age also plays a role. Children under 5 and adolescents exposed to TB are particularly vulnerable. Low body weight, defined as weighing less than 90% of an individual's ideal body weight, can increase susceptibility to active TB as well. Substance use is another contributing factor. Smoking tobacco, excessive alcohol use, and drug abuse can all elevate the risk of developing TB. Social and economic factors also matter. People with low income, those who are medically underserved, and individuals experiencing homelessness face increased risks due to crowded living conditions and limited access to healthcare services. Lastly, individuals with a history of untreated or inadequately treated TB disease are at risk, as are infants and children exposed to adults who are at increased risk. Understanding these factors is crucial for effective prevention, screening, and treatment efforts. By identifying individuals at risk, we can work towards reducing the transmission of TB and preventing the progression to active disease. Always consult healthcare professionals for personalized advice and guidance on TB prevention and management.